Let's explore the relief of Achilles tendinopathy and also general ankle pain, stiffness, swelling, lack of range of motion. And we'll start off with some definitions, and then we're going to take a look at a little bit of research. Okay, so we'll take a look at this piece of research here. Remember, a lot of research is free at healthcmi.com. Go to healthcmi.com, click on news, and take a look. And you'll see articles like this will come up. So different authors and researchers will either do original research at healthcmi.com or report on research that has been done, in this case, for example. So we'll look at that and look at standard treatments, and then we're going to look at some very interesting points. You can see a couple of them depicted here on the screen, Gunping and Chuanzhengzhu's, which are really, really helpful for people with Achilles tendon problems. The Achilles tendon ranks as probably the strongest and largest tendon in the human body. And big trouble, of course, if there's a problem with it. This tendon connects the aponeuroses of the gastrocnemius, soleus, and plantaris muscles to the calcaneus bone. So there's a lot of connection happening here between muscles and bone. And we see this problem occurring a lot in athletes, but also particularly in males, by the way. Men are more susceptible to this statistically than women. So let's take a look at this in detail. First, a few definitions, a little bit about it, and then we'll go from there. Let's see if I can bring up a picture of Achilles tendinopathy. There we go. And you can see two types. We'll talk about this a little bit. Here's this mid portion of the Achilles, which can have problems, tearing, strain, sprain, fraying, pain, nodules. And then here's what they call insertional tendinopathy, way down here at the bottom where the tendon inserts into the bone. That's another spot that tends to have a problem. This mid portion one above it tends to be between 2 and 6 centimeters above it. That happens to be a weak spot. And we'll take a look at that as well. So for that weak spot, which they're calling here in this picture, mid portion Achilles tendinopathy, many studies have identified a hypovascular area susceptible to injury. Located, it's approximately 2 to 6 centimeters proximal to the calcaneal insertion, so just above a little bit. And the Achilles tendon is essential for enabling calf muscles to exert force on the heel, which is necessary for walking and running. And then you also have the insertional area, which tends to get in a little bit of trouble. Now, there are main causes of Achilles tendinopathy. For example, paratendinitis is an inflammation affecting the outer layers of the tendon and includes conditions such as tenosynovitis, tenovaginitis, and this pathologic condition of paratendinitis, where the outer layers are affected, results in edema, exudate formation accompanied by inflammatory cells, and subsequently fibrous exudate develops, leading to crepitus, all kinds of sounds even, and restriction of the tendon's movement within the sheath. If left untreated, it can progress to a chronic state by developing immature connective tissue that expands an organized fibrin network known as adhesions. So adhesions can form due to inflammation. There's also chronic inflammation. Now that is basically something that triggers something called neovascularization, so more little blood vessels form, and this kind of weakens the tendon. It actually promotes the risk of tendon rupture. So chronic inflammation can literally lead to tendon rupture, and we could wind up with a surgical scenario here. So anyway, chronic inflammation results in increased disability and a lot of complexity. And that's often what we're going to see in the acupuncture clinic, is that chronic case will come in. Sometimes we'll see acute cases as well. Both are well suited to the treatment with acupuncture. And we'll compare and contrast that with what are deemed conservative treatments in conventional medicine. Now, historically, Achilles tendinopathy refers to tendinitis, that is, acute inflammation. So, sounds like a big word, Achilles tendinopathy, but basically acute inflammation, okay? which is distinct from the chronic inflammation. And technically, chronic inflammation is tendinosis. So acute inflammation, tendinitis; chronic inflammation, tendinosis. So even though I'll be calling everything tendinopathy here, we're really looking at both tendinitis, the acute, and tendinosis, the chronic, which we often see in the clinic. A lot of times people will come to an acupuncturist when everything has basically failed and we're almost a last resort before some kind of more radical intervention like a surgery, right? So this condition of Achilles tendinopathy can occur in athletes. It can happen in non-athletes. And it's usually due to an imbalance between muscle power and tendon elasticity. So too much force, not enough elasticity, big trouble, right? Achilles tendinopathies are divided anatomically into insertional and non-insertional tendinopathies, which we've looked at here in this picture. Great picture for that. Up here, this little weak spot, again, that 2 to 6 centimeter spot above, right here, right at the insertion. So insertional Achilles tendinopathy is a condition that affects the tendon's osseous attachment to the posterior calcaneus. And patients with this condition will experience pain in the distal third of the tendon, extending up to its insertion. They may also experiencing a lot of stiffness in the morning is typical with this. So something you can expect a lot of kind of letting you know. Of course, you'll palpate it and know where some of the tenderness is. Now, non-insertional Achilles tendinopathy is that mid to proximal third, again, 2 to 6 centimeters are proximal to the insertion. Now, when palpated, there may be nodules that are noticeable, and the tendon may exhibit enlargement as well. So again, you can feel around the area for nodules, and it can help in your diagnosis. Now, the diagnosis relies on many aspects of a physical examination. Usually someone's in a standing or prone position when examined, and you're looking for focal or even diffuse sensitivity, swelling, stiffness, perceived rigidity of the tendon, things like that. Of course, there are sophisticated devices like ultrasound, MRI, magnetic resonance imaging, CT scans, computed tomography that are also used to assess. And there's something called the Victoria Institute of Sports Assessment-Achilles, the Visa A questionnaire. So let's take a look at that questionnaire. This is considered kind of a gold standard, and it's just questions to see, what's going on. We'll look at a few of the questions. So, for example, for how many minutes did you have stiffness of the Achilles region when first getting up? Obviously, if there's a lot of minutes involved, that's a problem. Once you are warmed up for the day, do you have pain when stretching the Achilles tendon fully over the edge of a step, After walking on flat ground for 30 minutes, do you have pain within the next 2 hours, right? So you see what they're testing for. They're just seeing, hey, does it hurt when you do this? Does it hurt when this is happening? Do you have pain walking downstairs with a normal gait style? And it's a very simple assessment, but this is the Visa A. Do you have pain during or immediately after doing heel raises on a flat surface? There goes my workout regimen if I had a problem, right? So we need to protect the Achilles tendon, and so on. If you want to download something like this, you look up the Visa-A online, and you can literally find this assessment just about anywhere. How many single leg hops can you do without pain? All right, everybody, let's get our single leg hops going. Are you currently undertaking other sport or physical activities, etc.? And basically going through the gamut of what sports you're doing, how many minutes, where the pain is, things like that are really going to give us clues to what's causing the problem, what we can do. Now, conservative therapy for the Achilles tendon would be something like hey, reduce your activity level, let it rest for a bit, right? Doctors will often recommend non-steroidal anti-inflammatory drugs, for example. That's another one they do. Adaptive footwear, special, all kinds of footwear, and manual therapy. Obviously in Chinese medicine we have Tuina massage or Ama massage or even Shiatsu, Japanese therapy, or Korean massage. But basically rest is something that's highly recommended for recovering. Different kinds of stretching exercises. Various physical therapists will do several types of physiotherapy that way with all kinds of stretches, tendon loading exercises. There's also something called shock wave therapy. It's been around since the 1980s, also known as ESWT. I do believe that's outside of the scope of most acupuncturist practices, although depending on your state or country, you may be able to use this device if you're trained on it. But for the most part, it's not in the scope of practice. So this is a transcutaneous application of high energy acoustic waves to break down tissue to promote healing and repair. Again, first used in the 1980s. So that's an example of that type of device that's used. And then more radically, you might get into some surgery, whether endoscopic or minimally invasive, to repairs of detachments, to reattach, even tendon transfer therapy, So there's a lot of things go on once it's ruptured. But that's the high and low of it. Again, terminology aside, people are coming with pain, stiffness of the local region, and then we need to assess what are we going to do. And it's going to come down to, for at least from the acupuncture point of view, certain acupuncture points locally. Naturally, there's a variety of distal points we can use. Today's focus, we're going to look at some research, and then we're also going to look at a few local points and kind of get into it that way. So let's get into the research itself and start from there. Now, this was a randomized controlled trial at the Nellis and Eglin Air Force bases. And the researchers found that electroacupuncture, now they took an electroacupuncture approach, when used adjunctively with eccentric exercise, significantly improved short-term pain outcomes. So again, the exercises they're recommending combined with the acupuncture will get you good results. So basically, eccentric exercises or negative exercises involve lengthening a muscle when it's actively contracting. So this is the downward phase of a movement, like lowering a weight during a bicep curl or slowly lowering in a squat. And it can lead to greater overall strength and muscle mass. And of course, training on different exercises is beyond the scope of this piece of research, but again, feel free to look into all kinds of exercises that are used for tendons. They did find that the combination of acupuncture and eccentric exercises significantly improved short-term pain outcomes in patients with insertional Achilles tendinopathy. So this is a very specific research. They're using exercise plus acupuncture, and it's specific to, again, the insertional tendinopathy, which is right here at the bottom. They weren't looking at that mid portion for this. But that's how research is. It's often very focused. They tend to limit the points, and that can even limit the results of the outcome, which we'll see later in the study, that by limiting the scope of it, it also in some ways limits the power of the treatment. But let's take a look at that, and then we'll show more details how to expand on that and get some more power. So again, the study concluded that while both groups experienced functional improvement, the electroacupuncture group demonstrated superior pain reduction immediately following exercise sessions, indicating a beneficial role in electroacupuncture in managing acute pain. So their results basically showed pain relief. The trial was 59 participants. Again, sample size, I mean, this is all about funding. If you want 2,000 participants, that's an expensive study. acupuncture studies don't tend to get funded on that level. So yes, it's a small sample size, but I think the larger sample size is, of course, most people in their acupuncture practices over a period of many decades will see so many cases of these get better. Now, I'm presenting that anecdotally, but for me personally, and for my colleagues that I've worked with, we tend to just get great results. For generalized ankle sprain and strain and weakness, whether it's simple points like stomach 42 and gallbladder 40, kidney 3, we'll look into those in a bit, or straight on Achilles tendinopathy, we tend to get good results. Here's some research backing it up. So one complaint could be, well, it's only 59 participants. Well, we could use more funding, and that's always something that's very welcome. Of the 59, 52 completed the study, resulting in 69 affected Achilles tendons. So, of course, they're talking about bilateral involvement. Due to some subjects presenting with bilateral inflammation, all participants were Department of Defense beneficiaries of age 18 or greater, clinically diagnosed with insertional tendinopathy, defined as pain within 2 centimeters of the calcaneus insertion, and persistent symptoms of more than 8 weeks. So they're adding more than 8 weeks being part of that inclusion criterion for this study. And eligibility required a Visa A, that's the Victorian Institute Sports Assessment Achilles score of less than 60. And so they set up their parameters, where are you on the scale, and off they went to the study. Participants were randomized in 2 groups, one receiving eccentric exercise therapy alone, just normal physiotherapy, and the other receiving the same exercise program with adjunctive electroacupuncture over the initial 4 clinical visits. Electroacupuncture was administered at the first 4 clinical visits of the treatment group. The acupuncture points used were bladder 60 and 61, kidney 3 and kidney 4. They used Serra needles, stainless steel filiform needles, 0.25 millimeters by 40 millimeters, so they give you the diameter, the gauge, and the length. Were inserted using a firm catch of the tendon, so they're going to grab a nice Da-Chi response. So they inserted it until the firm catch of the tendon was palpated by the provider, indicating penetration of the paratendon or surrounding connective tissues. The paratendon is a vascular connective tissue layer surrounding a tendon that facilitates movement and provides essential blood supply for tendon healing and function. So they're going to penetrate that outer layer of the tendon where there's all this vascular connective tissue. The needling technique, the comment was it was tendon directed. And the electroacupuncture was a continuous current using an ES-160. That's the Ito unit, that little handheld electroacupuncture unit by Ito. Again, any biphasic wave electroacupuncture device will do. I tend to use the ES-130, and for more sophisticated cases, I use the bigger version of it, the ES-160, for things like low back pain. But the little handheld ES-130 is a great little unit. You can look it up if you don't have one. Very dependable, very safe, very reliable, will last decades. And that's made by Ito, I-T-O, in case someone's interested in checking that out. The 2 electrode circuits were employed, one connecting kidney 3, the negative lead, to kidney 4, positive lead. And thank you, researchers, for publishing that. So much research, they don't tell you where they put the positive and negative leads. I'm so happy they did this. So kidney 3 to kidney 4, on the same side, right? And then the other from bladder 61 to bladder 60. So negative lead at bladder 61, positive lead at bladder 60. And stimulation was delivered at a frequency of 30 hertz for 15 minutes per session. So that's considered a higher level than a lot of studies have been using. 30 hertz, a lot of people are using more that 2 to 6 hertz slow pulse range. This is much faster. They did the amplitude to patient tolerance level, just basically turn it up until the patient says, okay, I'm comfortable, and then if it gets uncomfortable, turn it back down. So again, kidney 3 negative to kidney 4 positive, bladder 61 negative to bladder 60 positive, 30 hertz, 15 minutes each time, and again to tolerance levels. That's pretty straightforward. This is not exactly a fancy treatment of any kind, but it is strong. Exercise protocol, regardless of the group, a home-based eccentric exercise regimen based on protocols outlined by the Arnold and Moody, and further supported by prior literature from the Childress and Butler. Eccentric exercises involves lengthening a muscle under load, and it's commonly used in rehabilitation protocols to strengthen tendons and reduce pain in tendinopathies. Each patient performed 2 specific exercises, 15 repetitions each, 3 times daily over a 12-week period. So these are great take-home things people can do. Usually getting resources like this, looking things up, having handouts, explaining exercises like this tends to be within the scope of practice of a licensed acupuncturist. So that is something you might be able to do in your state or nation, depending on the laws in your area. But typically that and offering Tai Chi and Qigong exercises as well is something that tends to be allowable under many scopes of practice. At each visit, that's the first week, 0 week, 2, 4, 6, and 12, patients completed 1 supervised set of exercises, reported pain levels pre and post exercise with a numeric rating scale ranging from 0, no pain, 10 to worse. And that's how they self-assessed. And both groups achieved functional gains over 12 weeks. The improvements in the Visa A scores did not differ significantly between them. The treatment group demonstrated a mean improvement of 21 points and the control group 22 points, so about the same. However, the number of patients reaching full recovery, defined by the Visa score, was much higher in the electroacupuncture group. So 6 patients full recovery and only 2 in the control group. So that's interesting. So addition of electroacupuncture, more people had a complete recovery. So there is some difference there. Now, what's noticeable with this particular protocol is electroacupuncture proved clearly, and this is the researchers from the Air Force bases, clearly beneficial was in short-term pain relief. That they definitely did. Now, of course, that's an indication that there's also a reduction potentially in inflammation and healing going on. The treatment group experienced a statistically significant reduction in pain immediately after exercise, with a mean decrease of 1 point in the NPRS. Conversely, the control group exhibited a slight increase in pain post-exercise. Now, are we following that? That's interesting. Exercise, if you had acupuncture, you have pain reduction. But no acupuncture, exercise, your pain increased. Now, as an acupuncturist, in our diagnostics, that is a massive difference. And as to a professional athlete, it's also huge. Now, the between group difference in pre to post exercise pain scores was also statistically significant, indicating that electroacupuncture provided effective acute analgesia during rehabilitative activities. So very interesting to me. And they're calling it just pain relief, but I can see conditionally that's a massive improvement, being able to exercise and have less pain. No major adverse effects were had with the acupuncture, so safe, interpretation for clinical practice. Now, while functional recovery over 12 weeks was similar between the groups, electroacupuncture significantly mitigated short-term exercise-induced pain. The findings suggested a potential role for electroacupuncture in enhancing patient adherence and tolerance to rehabilitation by reducing discomfort during therapy. And again, if you wanted to reproduce it, they did bilateral, so bladder 60 to 61, kidney 3 to kidney 4, with the 0.25 by 40 millimeter filiform needles. And that's just, informational. So it's enough to give someone enough information to reproduce what they did in the study. And that's something that's kind of helpful, really. If you were to translate, by the way, the 0.25 millimeter, that's a 32 gauge, or, Chinese gauge is 32, or a Japanese gauge, that would be a 5, right? Oftentimes this is given like with the plastic handle needles, they'll give it kind of a purplish color, although normally with thicker gauge needles like this, we have metal handle needles. So kind of interesting here. So they're relatively stout gauge, but not extremely thick. Treatments were delivered over 4 sessions during the early stages of a 12-week eccentric rehabilitation course. So 4 treatments, that's all they gave them. But look what it did, right? So that's great. Acupuncture uses an adjunct to standard eccentric exercise therapy, improves short-term pain outcomes in patients with insertional Achilles tendinopathy. Again, this is highly focused exercise. The integration of electroacupuncture can facilitate better patient tolerance during exercise sessions, especially in the acute phase of rehabilitation. And future trials are encouraged. Naturally larger sample sizes. What about that mid portion, not just the insertional tendinopathy? What about more treatment, right? What about adding moxa? What about adding Tui-Nam massage? What about herbal soaks, all kinds of herbal soaks? They didn't even touch on soak, right? And that's pretty much the research portion of this. Let's take a look at the Achilles tendon acupuncture in a more advanced approach. Now, at Health CMI, this made a little bit of buzz, that they found limited functional recovery in the study. A lot of pain relief, but limited functional recovery. But we're finding in our clinics across the board, everyone's having incredible functional recovery. So we suggest that the parameters of the acupuncture point selection might be very limited, whether you're adding some distal points or maybe you're adding some local points, right? And so we're basically suggesting that adding more points specifically for the Achilles tendon is a good idea. And I want to look at a few local points. Now, you may want to use a distal point, like let's say one by the wrist, small intestine 6, Yang Lao, for example. It's a chi cleft point of the small intestine channel. And that one is when the palm of the hand is placed on the chest. This point is located in the dorsal aspect of the head of the ulna in a cleft level with and to the radial side of the high point of the styloid process of the ulna. It's on the back of the hand, and you kind of rotate the hand, a little cleft appears, and maybe people use that one, small intestine 6. It's used more in shoulder pain and for eyesight stuff, but some people, for example, have used that. There are many distal points we can use, or points like gallbladder 34 or stomach 36, but we want to focus here on the local points. Gunping, Chuanchengzu, and Nushi. All right, so let's take a look at those. They're very interesting points. And those are the ones that are depicted here so that we get a good idea. Gunping right here. So right starting at that 2 centimeter, so that's more toward that mid portion Achilles tendinopathy, where Chuanchengzu is more for insertional, although many people will needle, let's say 6 needles, starting from Chuanchengzu through Gunping and maybe a little bit higher. So they'll do like a column like that of maybe 6 needles, or 3, maybe 1, 2, and 3, one at the top here, right? And they're given different names when you do those formations. But those are the 2 primary ones. Now there is the other one that I'm going to go over right here at the center. So if there is pain over the bone, right in the center of the calcaneus there, And a lot of times you'll feel a little divot, a little fossa there. You can needle right there over the bone as well. So let's take a look at those by description. So gunping, our first one, is located on a line connecting the medial and lateral malleoli. So go to the tip of the ankle on the inside and outside of the foot. At the posterior aspect of the body on the Achilles tendon. It's a local point for the treatment of Achilles tendon. And this acupoint is often needled to a depth of 0.5 to 0.8 sun, and it's traditionally indicated for foot disorders due to infantile paralysis, which is very interesting, right? But gunping is very helpful for Achilles tendinopathy. So again, go to the tip of the malleolus here, and the tip of the malleolus here, and right in between you'll find gunping, roughly in there. Okay. Then Chuanzhengzhu is located at the back of the heel at the middle of the superior margin of the calcaneus bone at the Achilles tendon. All right. So needle insertion is typically 0.2 to 0.3 sun. Indications include esophageal spasms, diseases of the brain, and lower back pain. How about that one? Now remember that the theory of opposites, so the lower you get, the higher something treats, you know, foot treats head, head treats foot, that kind of idea. That's the diseases of the brain. But those are the traditional indications: esophageal spasms, diseases of the brain, and lower back pain for Chuanzhengzhu. Pretty neat, right? And of course, insertional Achilles tendinopathy. You know, it's exactly correct for that. So again, gunping, a little bit above here, and Chuanzhengzhu. Really neat points. Some of you, I imagine, even if you've never heard of these names, have been needling these points all along anyway as Ashur points. Now, Nusi is located at the back of the heel at the center of the calcaneus bone, and it's typically a needle insertion of 0.2 sun. Now, this is interesting. It's for gingivitis and mental illness. And they mentioned some other points here: kidney 3, spleen 6, that's a nice one. Very common in acupuncture practice, and gallbladder 39 also. And these are all slightly above, but very good points to use as well. Kidney 3, spleen 6, gallbladder 39. But again, Nushi is, that would be just right here. So I guess if someone comes in with pain at the back of the calcaneus and gum disease, we're needling that point, right? All right. So that's just a nice review of that one. Now, ankle disorders, chronic ankle instability, for example, might accompany Achilles tendinopathy or even lead to it, and vice versa. That can be recurrent strains and sprains. Post-surgical recovery are commonly something seen in the clinic. And here are some of the local acupuncture points we often use: kidney 3, Tai Chi, bladder 60, Kunlun, gallbladder 40, Chu Shu, and stomach 42, Chung Yang. And we'll look at those in detail in just a moment. Remember that over time, some patients begin to internalize their condition, believing their ankle dysfunction is permanent. And they say, oh, my ankle disorder. They kind of own it. They don't really see a life without having this problem. It's important to get rid of that dysmorphia, that they're now internalizing it. We have to be careful about this. They've already pre-accepted they're going to live with it, but we don't want them. We want them to overcome it and to fight until they get better. However, many of these individuals can achieve full recovery or a substantial functional improvement with appropriate care. Both manual and electroacupuncture are employed to stimulate local microcirculation, reduce inflammation, promote tissue repair, often accelerating and supporting long-term joint health. We, of course, give you the source of that research in our articles, because that's what we do. We don't just make stuff up. We're looking at the intersection of traditional indications and uses of the points and modern research in something like this. Let's take a look at these points that we are recommending. These are extremely common points, obviously, but always fun to review some basics of the points. How about bladder 60? Let's look at that one. Kunlun Mountains, Jing River and Fire Point of the bladder channel. It's a Ma Dan Yang, Heavenly Star Point. Again, this is behind the ankle joint in the depression between the prominence of the lateral malleolus and the Achilles tendon. So it's kind of very local, all right? And we're zooming in on this. It was used in the study, but it's also recommended just for general care, right? So technically, this point is contraindicated during pregnancy because it could cause uterine contractions. It clears the heat, it lowers the yang, it pacifies wind and leads down excess, activates the bladder channel, alleviates pain, it relaxes the sinews, it strengthens the lumbar spine. We use it a lot for back problems, and it promotes labor. Now, I would say you'd really have to needle the heck out of this or even apply electroacupuncture to get promoting labor. I don't think casual needling can do that, but technically it is contraindicated during pregnancy. There are a lot of indications for this. I mean, everything from childhood epilepsy to dizziness, swelling and pain of the eyes, headaches. That's a very common one, actually. Mental disturbances, nosebleeds, pain in the teeth, especially the upper teeth, burning eye pain. Again, that's all about where the bladder channel goes to up towards the eyes and the head, right? So you're going to get a lot of that. Stiff neck, we see that a lot with stiff neck, even heart pain, lumbar pain, sacral pain. Again, these are bladder channel issues that come up. Sciatica, we use it a lot for. Again, the low back, the sciatica. Even pain behind the knee. Again, these are all course of the channel type of stuff. Hemiplegia, heel pain, of course. It's great for that and highly relevant to what we're doing. And of course, ankle pain. So one of the key uses in this particular examination we're looking at. But also used for like coughing and dyspnea, even fullness of the chest, and often added, now where it can be helpful is if there's difficult labor, you can add this point to help the labor along. But it's also used for retention of placenta. So many uses of bladder 60, a really interesting point. And in this case, they were using electroacupuncture from bladder 60 to bladder 61. So bladder 61, not used typically as much in clinics by most acupuncturists. Some acupuncturists will rely on it heavily. Servants respect Pukan. So it's on the lateral side of the foot, 1.5 sun inferior to bladder 60 in depression on the calcaneum itself. Okay, so you're going to go here, you're going to go down 1.5 sun from bladder 60, and you'll feel a little divot in the bone. And that's that point. And this is great for relaxing the sinew, activating the channel, stopping pain. But this is also good for things like headaches. Even when the head feels very heavy. It's also used for mental illness, things like that. Even painful urination. And again, like bladder 60, lumbar pain, legs problems, swelling of the knees, heel pain. But, interesting for headaches, and you'll find it's really a nice point to rub as well and relax. So I do like this point, especially when you find that little divot in the bone and you realize, well, that point deserves a little bit of love too sometimes, and great to massage. You massage that on someone will help you. But they might feel a lot of soreness in there. They might have a lot of tension in there. And especially if their athletes are putting a lot of pressure on the Achilles tendon, that's a good spot to rub and keep loose and not let it get into trouble to begin with. Kidney 3 was also in the study, and that was run to kidney 4, which is interesting, with electroacupuncture. So this is a Tai Chi or Supreme Stream, super powerful acupuncture point. It's in the depression between the medial malleolus and the Achilles tendon. So on the opposite side now, on the medial side of, compared with bladder 60, level with the prominence of the medial malleolus. And it's a shoestring point, it's a yuan source point, earth point of the kidney channel. Again, pretty easy to locate that nice little divot between the tendon and the ankle, the tip of the ankle. Usually, typical insertion is 0.5 to 1 sun. Sometimes people will join it to bladder 60. This point is used to, of course, benefit the kidney qi and yin. It's for deficiency kidney heat. It even benefits kidney yang. So a whole lot of issues there. Remember that as people age and the kidney yang is declining, they may have more problems with the Achilles tendon. This is going to benefit general kidney yang to support the tendons. It anchors the qi. It benefits the lungs as well. Remember things with asthma, like for the kidney qi to receive the lung qi, that inhale. We want that nice kidney qi to receive the lung qi. Great. And of course, it strengthens the lumbar spine. So many uses. We could never cover it all. Kidney 3 is one of the most powerful points on the body. Everything from deafness, tinnitus, and headaches to coughing with wheezing, dyspnea, coughing with blood, even insomnia, especially when there's yin deficiency heat. It's used a lot for like sexual issues like irregular menstruation as well. So everything from seminal emission and impotence to irregular menstruation, really affecting the genitals, right? It's also for frequent and copious urination. So a lot of that lower jiao stuff happening here. Again, so benefiting the kidney qi, benefiting yang and yin. Great for lumbar pain too, especially that gets worse over the day due to weakness. Let's say someone's hunched over at night or they're older and it's more of a chronic pain that gets worse throughout the day. Kidney 3 all day long. But of course, we're looking at kidney 3 in the context of this study for the Achilles tendon, and that they connected that to kidney 4, Dajang, great bell. It's a low connecting point. So you had the source point and the low point both used in the study together on the same channel. So that's interesting. So this is 0.5 sun posterior to the midpoint of the line drawn between kidney 3 and kidney 5 on the anterior border of the Achilles tendon. So it's right at the anterior border of the Achilles tendon. And kidney 4. Usually an oblique perpendicular insertion directed anteriorly. Okay, so about half a sun. And this reinforces the kidneys and anchors the qi and benefits the lung and strengthens the will and disperses fear. So again, this is one of those special points we use for emotions, but it's specifically for willpower and fear. Kidney 4, very interesting, right? We see that a lot in the treatment of mental disorders and helping people, but also benefiting the lung and anchoring that qi. So asthma, we see it a lot with that. Coughing with blood, dyspnea. Dry tongue, painful throat, a lot of kidney stuff affecting the throat as well, and the lung stuff affecting the throat, difficulty swallowing, even palpitations, even difficult urination, and even sometimes abdominal problems like constipation with a distended abdomen, stiffness and pain of the lumbar region. Kidney 4. Interesting point choice. And again, they ran that to kidney 3 with the electroacupuncture. Gallbladder 40. Most of you are waiting, when are you going to show us gallbladder 40? Everyone uses that point for all kinds of ankle problems. Absolutely, Chushu. Mound of ruins, it's yuan source point of the gallbladder channel, and relatively essential for many kinds of ankle problems. So if there's joint instability, we want to protect both the Achilles tendon and, of course, the ankle in general and everything there. This is a great one. It's at the ankle joint in the depression anterior and inferior to the lateral malleolus. So go to lateral malleolus and go anterior and inferior, and you'll feel that little ditch in there, and that's your mound of ruins, gallbladder 40. Spreads the liver qi, clears gallbladder heat and damp heat, right? Activates the channel, alleviates pain, benefits the joints, regulates the Xiao-Yang channel. So it's for everything from distending pain of the chest, swelling of the axilla, even pain and problems of the lower abdomen. Herpes zoster it's used for. Again, it's gallbladder Shaoyang channel stuff, so really good for things that affect the Shaoyang channel. But also, we use this a lot for headaches, especially one-sided headache, or any kind of swelling or pain around the eyes and headache around the eyes, even superficial visual obstructions, poor eyesight. Sometimes people use it in cases of malaria with the cold shivering, you know, that kind of Shaoyang stuff, even vomiting, acid regurgitation, it's very good for. And special for neck pain, special for pain of the lumbar spine. So neck and lumbar spine, it's great stuff. But here, for sure, great for weakness of the ankle, ankle instability, even swelling, acute swelling of the ankle. And likewise, you know, in a homolog, it's also great for wrist stuff. So great for wrist problems, wrist and ankle. But this is, you know, an incredible point for ankle problems of all kinds. Really can't live without it, right? Stomach 42 is a great example of a point that might come in handy for the ankle. It's a Yuan source point of the stomach channel, rushing yang. So this one is on the dorsum of the foot. You can see it right there. In a depression formed at the junction of the second and third metatarsal bones and the cuneiform bone on a line between stomach 41 and 43 at the point where the pulsation of the dorsalis pedis artery may be palpated. So caution, don't puncture that. If you feel a pulsating artery, don't needle it. I mean, that's obvious. And oblique insertion, usually 0.3 to 0.5 sun. Clears the heat from the stomach, harmonizes the stomach fu organs, you know, intestines, the stomach, heart calms the spirit, activates the channel. And we use this a lot for abdominal problems, you know, digestion problems, vomiting, epigastric pain, abdominal distension. It can be used for toothache, yes, and deviation of eye and mouth, fever sometimes, chills and fever, you know, kind of malarial disorder, Shaoyang issues, mental disorders as well. Of course, swelling and pain of the foot, and atrophy of the foot, and great in general for the ankle. So another great point. Again, there are many points you can use. I mean, you could choose another one, let's say spleen 5 as local, or other points. You know, we can't go into every local point here because there's so many to choose from. So if you feel there's a problem at a particular point that you palpate, you may want to needle that or run electricity through it. And so hopefully that gives you some examples of some standard points and, of course, some really interesting points that we don't use a lot on the Achilles tendon that we use. And hopefully you find that very interesting. We definitely took a look at some research. We looked at some traditional points. Bottom line is acupuncture can do a lot. I think preventing the need for surgery and preventing ruptures when there's a lot of chronic swelling is very important. Obviously stopping pain, getting people rehabilitated, allowing them to follow through with their exercises without pain is another real strong aspect to our treatments that we do. And I hope you really enjoyed this kind of deep dive in the Achilles tendinopathy.